Hello, everyone, and welcome to Muslim Sisters of Staten Island's It's Taboo, Let's Talk. Now, what we have for you guys today is we're talking about HPV and communities of color. Hold on, I didn't put up our little live. Wait, wrong way. Live with Missy. Yes. So we're going to be talking about HPV and communities of color in this week's workshop. We have some really great panelists. We also have our executive director that's going to explain a little bit more about the purpose of this event. Plus, I'll be putting in a poll both at the bottom of the screen and in the comments section for you guys to be able to fill out, just so we can have a bit of an understanding of what you guys know about HPV and kind of other, related diseases to that and whatnot. So let me put my little banner at the bottom. So this is the banner that has the link that you can go to. I'm also going to be putting it in the comments section as well. So the first person I am going to bring up onto the screen is going to be our executive director of Muslim Sisters of Staten Island, Sophia Abdulkawi. Sophia, hello.
Hi, everyone. Welcome to It's Taboo, Let's Talk. I think this is the second one we're having so far for 2021. We are happy to have you here, and we're talking about HPV, and this month is Cervical Health Awareness Month, and that's one of the reasons why we wanted to talk about specifically HPV. And the purpose of this event is to talk about cervical health. And one of the things as women we are always worrying about is our cervical health, right? And so the purpose of this project, or actually this program today, is to work with our community partners such as Northwell Health to talk about cervical health, and specifically to HPV, which is one of the more prevalent health issues for women of color. And so we wanted to give you some resources and some information to guide you in getting the right type of care that you may need for your cervical health. So welcome, and I'm going to pass you on to Barbara from Northwell Health.
Sorry, I thought you called me. My bad. So we're going to pass it off to Carolyn first, because she needs to talk a little bit about SIUH, aka Staten Island University Hospital. So let's bring Carolyn Simone. I said it right correctly, Simone?
Yes, Simone.
All right, thank you. Thank you so much, Sophia.
Thank you, Sophia and Naja. I too would like to welcome everyone to this evening's HPV program. Before we begin, I just want to tell you a little bit about myself and my role here at Northwell Health, Staten Island University Hospital. I've been fortunate enough to work for Staten Island Hospital for 30 years, and I'm in the field of oncology for 25 years. I'm a licensed clinical social worker, and I currently work in outreach services. So I provide cancer prevention and screening programs to the community. I'm so passionate about health and wellness, and most recently I've become certified in Reiki, yoga, and mindfulness and meditation. I do sessions with team members at the hospital to decrease their stress and enhance their overall health and well-being. There are so many parts of my job that I love sharing with colleagues and the public, and presentations such as tonight's program highlight one of the many reasons that I continue to enjoy this work. And it's as it supports me and educates our community members. As Sophia said, January is Cervical Cancer Awareness Month. So the first month of every year presents so many opportunities. And one opportunity is to communicate specifically in communities of color on how the HPV vaccine can help prevent cancer. Cervical cancer can often be prevented. So in a few minutes, you will hear from our panelists more specifically on the benefits of the HPV vaccine and how this extends to you and your loved ones. So on behalf of Staten Island Hospital, it's such an honor to partner with you, Sophia, and your professional organization, the Muslim Sisters of Staten Island. We thank you all for what your organization does, how you're supporting and educating the community, and programs like these highlight our need to work together to expand our outreach goals. I'd also like to thank the American Cancer Society. They suggested that we do this presentation on HPV vaccination, and they've provided us with support and resources necessary to make this a huge success. I'd like to thank the panelists for volunteering their time and expertise in discussing tonight's important topic. And I'd also like to thank the participants for taking time out of your schedule to be present and listen to this worthwhile presentation. I would like to introduce now some team members of the hospital. Lisa Palmer has been with the hospital for 10 years and with the Cancer Center for 8 years in various roles. She has helped countless patients and their families with cancer information and resources. So I just wanted to acknowledge her and what a great asset she is to the hospital. So our first panelist that I had the pleasure of introducing this evening is Dr. Lee. Dr. Lee is the director of the Division of Adolescent Medicine at Staten Island Hospital. She has over 40 years of experience and is a dedicated clinician, educator, and researcher in the field of adolescent medicine. Under her leadership, there's been expansive growth within the Division of Adolescent Medicine, including the grant program and the comprehensive adolescent pregnancy prevention program. These programs provide opportunities to increase existing clinical services to underserved populations and develop prevention and education services to adolescents. Dr. Lee's passion for high-quality healthcare is evident as she strives to improve the HPV vaccine rate. Our next panelist is Dr. Babar. She graduated from Touro College of Osteopathic Medicine in 2019. She's a second-year pediatric resident at Staten Island Hospital, and we are so incredibly grateful that she will join us for this presentation. Our last panelist this evening is Amnia Elkush. She's a fourth-year medical student at Touro College of Osteopathic Medicine. Welcome, Amnia, and we are pleased to have you join in our presentation. So now you will hear a PowerPoint and a discussion on HPV. So I'm pleased to turn the program over to Dr. Lee, Dr. Babar, and Amnia Elkush.
Thank you so much for that introduction, Carolyn. And I'm going to bring up our doctors. So back, Carolyn, quick. And we're going to first have our first, which is our resident, which is Omneya Elkush. Hello, Omneya. How are you? I'm going to pull up the PowerPoint so you can let people know about HPV.
Sure thing, you got it. I wanted to start off by saying good evening to everyone. Assalamu alaikum, which means peace be upon you, to everyone here. I hope everyone's staying safe and warm. And I also wanted to thank everyone for being here. It's really a privilege that you guys are having us. And I also wanted to start off by saying that we hope that this is a safe space to have a conversation that's professionally personable and just educational. That's the main purpose of this discussion. So we're hoping that we address any concerns or questions, and hopefully we can give you some helpful information. So let's get started with the presentation. So the first slide. So what is HPV? So HPV is a virus, and it is a common infection of the reproductive tract. There's over 100 types of this virus. So they can cause warts, and this is the non-cancerous type that it can cause warts, and then there are cancerous types that can cause reproductive cancers. So penile cancers, vaginal, cervical, vulvar cancers, and those are specific to each gender. And then there are other cancers that can be caused. So mouth, throat, and anus, rectal cancers, those are not specific to genders. Those can happen in either males or females. Okay, so this is a very common infection. 8 out of 10 people have HPV at some point in their lives. Both men and women are at risk, but where our focus right now is women. And basically this virus is a silent virus. So most people don't know that they're infected. And you can you develop symptoms years after you've been infected. And next slide. Okay. So what types of cancers is HPV? As we've discussed, so for females, it's cervical cancers, and that's 90% of cervical cancers can be attributed to HPV. Anal cancers, which can be in males and females, that's 90% of them can also be attributed. Then vaginal cancers specific to females, 75%, 70% for vulvar cancers. And sorry, the poll was in the little HTTP thing at the bottom is I'm not sure if that can be removed. Well, the banner, I'm not sure how to remove it, sorry. Okay, awesome, thank you. And then 70% for mouth and throat cancers and 60% for penile cancers, which would be specific to males. Now, approximately 2,600 New Yorkers are diagnosed with HPV-related cancers every year, and this is from 2018, but I looked up for more recent, and it's about the same number. Okay, so this is a very important slide. This basically shows the persistence of HPV infection and basically how it progresses through the ages of people. So at the bottom, the x-axis, you have 9 years, 15 years, 30 years, 45, 60 years. And then the y-axis is showing you the population prevalence. And basically what this graph is showing, so the pink line that shows HPV infection, it shows that there's a increase in the prevalence from starting at about 15 years of age. And the prevalence basically goes up, and then there's a dip because the infection can resolve, but if it does not resolve, it can go on to become precancerous, and that's when you see it closer to 30 years. That's where you can see the precancerous cells when there's cervical screening done. And then if that's not done, then it can progress and become cancer. And then this brings up the idea of something called primary prevention in medicine. And basically what that is basically actions that you take to prevent a disease or injury by preventing exposure to the hazards that can cause that disease. So things that are examples of primary prevention are things like immunizations, which is the example of HPV vaccine. Other examples could be exercise, proper nutrition, health education. Those are all examples of primary prevention. And if we look back at the graph, primary prevention, so for it to be primary prevention, HPV, we want to make sure why it's basically sorry, I just lost my train of thought. So why it's recommended to get the HPV in the pediatric population, so around 9 to 14 years of age, is because we want to make sure that we have the biggest level of protection. So before children are exposed to the HPV virus, we want to make sure that they have protection from it. So that's the whole idea with it. And then there's secondary prevention, and that's basically when you take actions to catch or halt the progression of the disease. And Dr. Babar will be talking about that, and that's basically cervical screening, cervical cancer screening. And basically, you do it, it's a secondary prevention as in the fact that it helps prevent complications, and you want to catch it before it becomes symptomatic or it becomes cancerous. So yeah, so Dr. Babar will take the lead on that discussion.
Assalamu alaikum. Okay, so next slide. Perfect. Okay, so let's talk about routine screening for cervical cancer. Screening can help identify people who are at increased risk of cervical cancer. If precancer is found, it can be treated, stopping cancer before it starts. Screening can find cervical cancer early when it is most easily treated, so this is key. Next slide. So this graph depicts a timeline of cervical cancer screening guidelines as recommended by the CDC. The numbers you see listed, 20, 30, 40 onwards, represent ages. So the first screening point you can see comes up soon after age 20. So let me walk you through it. Women who are at high risk of cervical cancer because of suppressed immune system, for example, people with HIV infections, organ transplant recipients, or long-term steroid use, or because they were exposed to something called DES in utero, may need to be screened more often than recommended. DES is a compound that was previously prescribed to pregnant women. Thankfully, it's no longer used because we now know it causes problems for children born to mothers who took it. But DES exposure is something we ask about in women born between 1938 and 1971, as this is when it was prescribed. So back to the graphic. All women should begin cervical cancer testing at age 21 per CDC recommendations. Women aged 21 to 29 should have a Pap test alone, no HPV testing, every 3 years. Women between the ages of 30 and 65 should have co-testing. This is a Pap test and an HPV test every 5 years. Women over 65 years of age who have had regular screening in the previous 10 years should stop cervical cancer screening, as long as they haven't had any serious precancers found in the last 20 years. Women who have had hysterectomies without removal of the cervix should continue cervical cancer screening according to these guidelines above. Women who have been vaccinated against HPV should still follow these guidelines. Next slide. So, while the previous slide talked about the CDC guidelines, this slide discusses the American Cancer Society guidelines. I want to emphasize that these two slides have slightly different recommendations, but both are considered correct as the criteria is dynamic, meaning it constantly changing and adapting as we learn new information. So, which guidelines are used are at the discretion of your doctor, but I will mention that the gynecologist I spoke to at SIUH stated that they use the CDC recommendations as it starts screening a little bit earlier and is therefore more conservative. So the American Cancer Society guidelines for cervical cancer screening go like this. People under the age of 25 should not be screened. Between 25 and 65 years of age, the ACS recommends that people with a cervix who are at average risk for cervical cancer get screened using either one of the following. A primary HPV test every 5 years, of course test is best, or a co-test every 5 years, and again, this means both a Pap and an HPV test, or a Pap test alone every 3 years. The most important thing to remember is to get screened regularly, no matter which test you get. Next slide. Now let's discuss some HPV vaccine facts. Fortunately, we have a safe and effective vaccine that can actually prevent the infection and therefore HPV-related cancer from forming in the first place. HPV vaccination is both for boys and girls and is most effective when given between the ages of 9 and 12 years of age. With more than 270 million doses administered to date, the side effects are closely monitored and we know it's very safe. So some people do experience mild side effects such as pain, redness, or swelling at the injection site. However, this is common after any type of vaccination, and these symptoms are self-limited and go away quickly. And again, I want to emphasize the fact that the vaccine works best when given at the recommended ages above to protect you down the line. However, that is not to say that if you are older than these ages that you can't get the vaccine. The current recommendation actually allows for men and women up to age 45 to receive the HPV vaccine to gain some level of protection from various forms of cancer, as we discussed previously. Next slide. So this graph is showing the vaccination rates in Staten Island and the surrounding area for adolescents between the ages of 13 and 17 years old. As you can see, where we are in Staten Island is bright red. This means we have some of the lowest vaccination rates of the surrounding area. And I want to emphasize that New York City as a whole isn't doing much better, with the overall rate of HPV vaccination in New York City being only 67.7%. Next slide. So why is that? Why, when we have a vaccine, we have data that shows it helps prevent a form of cancer, do we have such low vaccination rates? Well, some barriers to vaccination include things like lack of parent buy-in, meaning some parents just choose not to vaccinate their child against HPV. Another is lack of provider buy-in, meaning some physicians, for their own reasons, don't carry or administer the vaccine. The next is lack of access, meaning even those people who would consider getting the vaccine don't, because they don't have a place to go near them where they can get vaccinated. And finally, lack of knowledge and trust, which hopefully what we're working towards today is building and alleviating. So I sincerely hope that by the end of this presentation, this is no longer a barrier to anyone watching. And the last thing I want to mention is just a bit more on specific disparities, specifically in cancer recognition and treatment that impact women of color. I think it's important to discuss these disparities as, again, the HPV vaccine is a vaccine that helps you protect you from certain forms of cancer. So certain groups in the United States experience cancer disparities because they are more likely to encounter obstacles in getting healthcare. And unfortunately, women of color are considered a part of this group. Obstacles to getting healthcare include things like having a long travel distance to screening sites or not having health insurance. Even things like lacking transportation to a medical facility or not having a job that offers paid medical leave. This becomes particularly relevant to our discussion today about the HPV vaccine because Black and Hispanic women had higher rates of HPV-associated cervical cancer than women of other races and non-Hispanic women. Vaginal and vulvar cancers are rare, but it is estimated that about 900 new cases of HPV-associated vaginal cancers and 4,100 new cases of HPV-associated vulvar cancers are diagnosed in the United States each year. And more Black women get HPV-associated vaginal cancer than women of other races. So the HPV vaccine can be a powerful tool in communities of color. Now Dr. Lee is going to take over and talk to you a little bit more.
Hello, everyone. Thank you so much for inviting us all. We're very happy to be here. And I'd like to thank Anika and Amnia for doing a great job in discussing HPV and HPV vaccine on a regional and local level as it affects us, as well as on a national level. Obviously, we strive to reach a goal of 100% vaccination rate in the United States. And unfortunately, it's somewhere around 50, 54, 55% complete HPV vaccine rate. So what I'd like to discuss now is some of the barriers on a global level. So how does HPV affect us in our global community? Well over 500,000 women on a yearly basis come into contact and become infected by HPV. And 250,000 will suffer the consequences of that and die from it. It is unfortunate that even on a global level, there has been much vaccine misinformation, and that has led to devastating consequences. In the first box, if you see Denmark, they had a very negative information campaign regarding the side effects of HPV, which were totally unfounded. They had close to a 90% vaccine rate initially when it first came out. And then after this misinformation that came out nationally, it went down to about 50%. So about 26,000 women in their country went unvaccinated. And the predictions from this, they say, will lead to additional cervical cancer cases and 45 additional deaths from cervical cancer. What fortunately in 2017, there is an upside to this. In 2017, they did start a campaign on Facebook called Stop HPV, Stop Cancer. And now the vaccine rate is slowly going up again. So that is a good thing. In Ireland, a similar anti vaccine lobbying group led an HPV misinformation campaign on social media in 2015. And in 2014-15, 87% of eligible children completed the series. After the campaign, parental trust in the vaccine totally plummeted, went down, so that by 2016-17, only 50, half, even initiated the first shot in the series on the vaccine. And again, there have been, what did the government do in response? They ran focus groups, had parent testimonials on television, and now it's slowly going up again to about 61% in 2017. In Japan, unfortunately, something similar did happen where there were unconfirmed reports of adverse effects and events from the HPV vaccination, and they were covered heavily in the media in 2013. And unfortunately, HPV vaccination coverage fell from 70% to 1%, which was devastating. Despite the fact that the Japanese professional medical community has been lobbying and advocating for and promoting the vaccine, it has not unfortunately changed very much. And this drop from 70% to 1% is predicted to lead to an additional 25,000 cervical cancer cases and more than 5,000 additional additional deaths. Okay, next slide, please. So I'd like to say globally, there have been some huge HPV successes. In Rwanda in 2011, Rwanda became the first African nation to implement an HPV vaccination program, and it has since achieved greater than 98% coverage, which is awesome. It's just an incredible number in its HPV vaccine target population. And this was accomplished through a combination of many things, through government commitment, a school-based vaccine delivery system, and strategies to reach out-of-school girls. And in Australia, HPV vaccinations are administered through nearly all Australian schools. The nearly 9 million doses given to girls is said to have led to a 77% reduction in HPV types responsible for most cervical cancers, and a 90% reduction in genital warts in heterosexual men and women under the age of 21. And then finally, in Bhutan, in 2010, a school-based vaccination program led to a 3-dose vaccination coverage to 99% among 12-year-olds and 89% to 13 to 18-year-olds. And this was implemented due to a strong political commitment to address the most common cancer in women. So you can clearly see that the most successful programs have been with strong support from government and the schools, as well as the communities that they serve. Can I have the next slide, please? Thank you. In this slide, it shows a number of different things. It talks a little bit about vaccine hesitancy and missed opportunities. If you see on the vertical axis, you see the number that represents the number or percent vaccinated. And the horizontal axis, it talks about the years from 2006 and to the end, all the way to the end to 2017. And in the middle is 2013 is where some revised data about for providers in defining how to give the vaccine. But you can see that the tetanus shot, or Tdap, is in the red and has really increased incredibly from 2006 to 2017. And so has the meningococcal vaccine, which is in the darker blue. And then somewhere around the yellow is the HPV vaccine with its original recommendations for the 3-shot series in 2011 to 2015, which then changed into the lighter turquoise. And then you see in 2016 to 17. But you see there's a huge difference between children who got vaccinated with the tetanus shot, the Tdap, and the meningococcal vaccines, which are required by schools. And then at the same time, one can also offer the HPV vaccine, but you can see it's fallen way short of the same success of you seeing the Tdap and the meningococcal vaccine. So there clearly, this graph shows some missed opportunities where children could have gotten or started at least the HPV vaccine at the same time as getting the tetanus shot and the meningococcal vaccine. Can I have the next slide, please? So with going back to Australia and their incredibly successful vaccine campaign, and these graphs just basically illustrate how well the HPV vaccine can prevent cervical cancer. So you can see in the horizontal, it's the year starting with 2015, going as far out as possible to 2095 and 2100 to the next century. And then the vertical axis is the standardized incidence of cervical cancer per 100,000 women on the top, and standardized mortality associated with cervical cancer per 100,000 women on the bottom. And they are predicting with this successful vaccine campaign in Australia that they can basically eliminate cervical cancer and mortality by 2035, which is an incredible feat. This is a totally preventable cancer by vaccination. Could I have the next slide, please? Okay, so in summary, with the HPV vaccine, you can clearly see that it is highly effective and it is very safe. And it's and everyone looks at the financial aspects of these things. So is it cost effective? Yes, without question, is it cost effective? It is far less costly than treating cancer. But more importantly than anything else, that it is successful in that if we can stay healthy by providing a vaccine and which will prevent cancer, that is more important than anything else. And there's also evidence-based policies for increasing HPV vaccination rate with increased funding for education and promotion, improving vaccine access, which Anika talked about a little bit, and by possibly adding it to school requirements. And then we will hopefully ultimately see an improvement in the vaccine rates. So next slide. Okay, so where do you get the vaccine? Well, certainly on Staten Island, you can go to your primary care doctor, your pediatrician, your internist, your OBGYN. At the hospital, it is you could see Dr. Babar or myself, and we would give it to you in our ambulatory outpatient settings. That's where we're located at 242 Mason Avenue. I do know that it is also offered at the Center for Women's Health, which is our adult GYN site. So there are very many. There should be. You should be able to access it relatively easily. I run two school-based health centers. One at New Dorp and one at Port Richmond, and we definitely offer it at both school health center sites as well. Next slide. Okay, now I'm going to pass the microphone back to Carolyn.
Thank you all for that presentation. It was so comprehensive and really excellent. And I'm sure we'll have many questions in the Q&A portion of the talk later on. And I'm sure you eased so many people's concerns about the vaccine. Really excellent. Thank you all. Now I will talk about some resources. Next slide, please. So we do all these community programs and screenings to help with prevention and early detection of cancer. But unfortunately, sometimes our friends, our family, people in our community, and ourselves get a diagnosis of cancer. So if that happens, we need to know where to turn, and it's important to know what we have right here on Staten Island in our own community. So the Cancer Center at Staten Island University Hospital, Northwell Health, we have comprehensive cancer services under one roof. So we have medical oncologists and hematologists. Our nurses are all oncology certified. We have a cancer information line that provides resources and information. We have social workers who do individual and family counseling. We have support groups, nutritionists, which is an essential part of cancer treatment, financial representatives if you have a question regarding insurance or bills. We have a palliative care department, a dedicated pharmacy, and a lab, everything under one roof. Another great service that we have here at the Cancer Center is we have nurse navigators who are here every step of the way for you. They offer you support throughout your treatment and follow-up. They advocate on your behalf. They streamline your appointments. They talk with your healthcare providers and get answers to all your questions. They help you with financial resources, transportation, and childcare assistance. So that's an amazing service that we offer. Another thing that's excellent about our Cancer Center is that we're Commission on Cancer accredited, which is a really big deal. Commission on Cancer is a quality program of the American College of Surgeons, and we have been granted a 3-year accreditation, which means we have met 34 Commission on Cancer standards. We're evaluated every 3 years, and we go through a survey process, and we maintain levels of excellence in the delivery of comprehensive patient-centered care. And lastly, I think is so important is the personalized care that we give to each patient. So in my 25 years here at the Cancer Center, I have witnessed firsthand the personalized care that is given from our nurses and our oncologists. They treat everyone like their own family. I have personally witnessed our oncologists calling their patients late at night in the evening. Everyone is treated like family, and that's why we're a comprehensive cancer center. So I have put the address, call for appointments. We have a cancer information line, and then you can browse our website. Next slide, please. This is a really great service. This is the Cancer Services Program of Staten Island, which is run by Barbara O'Brien, and she's a great resource. She provides screenings, breast, cervical, and colon for the uninsured and underinsured. So if you have any questions and you don't have any insurance, or you do have insurance, but it's a big deductible and copay, and you need breast, colon, or cervical, please contact Barbara O'Brien. She's a great resource at our hospital. Next slide, please. And then we have our American Cancer Society, which is an amazing resource. We're actually partnered with them for today's event. The American Cancer Society's mission is to save lives, celebrate lives, and lead the fight for a world without cancer. Until that happens, they'll be funding and conducting research, sharing expert information, supporting patients, and spreading the word about prevention, all so you can live longer and better. And there's their contact information, their phone number, and feel free to go on their website. There's lots of great material, resources, printouts, everything. So thank you, American Cancer Society. Next slide, please. And now we have our questions and answers, which I'm sure there will be many of our questions. So if now I could turn it over to Sophia, and she can manage the chat or any questions that can't come up.
Okay, let's see what we have here. It says okay, someone had a question. I'm just looking. If you already have HPV, that it doesn't become cervical cancer outside of getting a pap smear. Can you hear me?
Yeah, we can hear you. So that's a great question. The first thing I want to emphasize is even if you have a form of HPV, you still should get the HPV vaccine, because the HPV vaccine protects against multiple strains of HPV. So there's not just one type of HPV. So if you have one type, the vaccine can still help you protect yourself against the other types of HPV as well. But if you already know you have a form of HPV, you should continue with screening routinely, as well as getting the vaccine to help protect yourself.
Okay. Another question is, what are some of the signs to look for HPV? 990.
Well, I think Omnia mentioned early on in the beginning of the presentation that unfortunately it's a silent infection, and you really cannot tell. There are no symptoms associated usually. So with precancerous changes. So unfortunately, the only way to do it is by routine screening with pap smears and HPV tests.
I just switched real quick with Sophia. Sorry, guys. I have a question. That's why I switched. So my question is, because you guys talk a lot about HPV and how it affects communities of color and different things like that. So myself as a Black woman, right? Should I be more concerned about and any person of color, but specifically talking about Black women, should we be more concerned about getting HPV faster, and what may be like what is causing, perhaps if you know, like what is causing us to have potentially to get HPV more as opposed to other groups? If anyone has like an answer to that. I know that's like a really like statistical question. I could pull up the slides again.
No, it's a great question. So again, we do constantly do research, doctors as a society, as a group, to kind of figure out, what cancers are more prevalent in one population versus the other. So this is something that we're seeing, that unfortunately, as we mentioned in the presentation, the HPV-associated cervical cancer in women of color, specifically non-Hispanic women and Black women themselves, it just happens to affect them more. Could that be because of certain barriers to not only vaccination, but just screening? Could it be because members of this population either don't have access to healthcare as readily? So even if they could have been caught in a pre-cancer stage, they don't see their doctor soon enough and then end up crossing over into the cancer phase and then are diagnosed at I have cancer phase versus I have pre-cancer, I can do something about this phase. So that's one of the reasons. Again, I think it goes back to these barriers that unfortunately do impact women of color more than other populations. I don't want to say that, say 100% it's just Black women or Hispanic women that are affected by HPV-related cancers or cancers in general more than other populations. There are some forms of cancer that tend to affect women of Caucasian descent more frequently than others, but HPV-related cervical, vaginal, and vulvar cancers unfortunately do impact the Black community at significantly higher rates.
Okay, thank you. That gave me so much information because like I'm learning a lot from you health professionals, and thank you guys so much for like the presentation, explaining everything, because that would have just been a whole bunch of words that I would have read and didn't understand. So I really appreciate you guys taking the time out to explain this to the community and having us understand and also answering some of the questions that our audience members who are seeing us on their screen are asking, because there is a lot of lack of information. There's actually another question that was asked. I think you may have answered it in the PowerPoint, but I'm going to pull it up. This is from YouTube. They said, do you go to your gynecologist to get vaccinated, or can you go to any health clinic?
Right, so you can go anywhere that provides the HPV vaccine. So where I work in the MAP clinic, I primarily see pediatric patients on my side. Dr. Lee also works in the same building at the MAP clinic at SIUH. She sees the adolescent patients. We can both give you the HPV vaccine. I did ask the gynecologists that run the clinic at SIUH. They will also give you the HPV vaccine. So whether you come to one of us or the gynecologist at SIUH, we are all able to give it to you. If you see a private pediatrician, most pediatricians on the island, I am aware, do give the HPV vaccine as well. And again, if you happen to go one of the two schools where Dr. Lee's clinic is, you can get the vaccine from her at one of those places as well.
Okay, that's good. That's convenient, because I know a lot of times people, especially with the way like appointments can be and like different things like that, having multiple places that they can go to is very, very comforting, because this is something really important. So I have a whole bunch of questions in my head. I'm sorry. So another question that I have for you lovely women is there anything that can help prevent you from having HPV in particular? Like, is there something like, okay, if I do these things, I'll be less likely to get it? Or is it something that, like, you know, it's not that it's bound to happen, but it's something that's not necessarily like avoidable, if that makes sense?
So the vaccine is the big one that prevents getting HPV in the first place. Unfortunately, it is just very prevalent in the population and at large. So there is a high chance that you're going to come into contact with it if you are unvaccinated. And then subsequently down the line, again, this would be years down the line, have some kind of illness from it as well.
Okay. Okay.
Yeah, I totally agree. If you get vaccinated at an early age, your body builds immunity, and it turns out that when I think the recommendations are usually starting at 11, but you can give it as early as 9. The immune response that your body makes to the as being exposed to the vaccine, your body makes antibodies to HPV, so that if your body is exposed for some reason, you can fight the infection so that you don't get an infection, and then you ultimately don't get the cervical changes that happen in a precancerous state or cancer itself. So the earlier you get it, at 11 is the ideal time, because you have such an incredible immune response at that time. Your body makes safe antibodies to fight it. So that is really the way to prevent it, is to get the vaccine.
Thank you.
And to piggyback off that a little bit more, if you get it under 14, so between 9 and 14, you only need 2 doses in the series for HPV vaccination. If you get it from 15 to 45, you need 3 doses in your series for HPV vaccination. So we do see that, you know, the vaccine antibody response drops off a little bit the older you get, but you do still get protection. So you should still get it if you're older.
Okay. Oh, and I'm going to bring Sophia up. She has a question.
Wow. Yeah, I actually work for a GYN, so I do give these lovely vaccines on a regular basis. And what I've been finding is that there's a lot of older women, maybe age 24 and up, are coming up with first line HPV after not having any exposure from when they had their last pap smear. And they're like, well, why is this happening? Honestly, I even have had people who are not sexually active pop up with HPV, and they're like, but I'm not doing anything, so why am I getting it? So is there a true explanation as to why that's happening? to have HPV and not be sexually active?
I know that it is skin to skin. So if there's some kind of minute exposure, it is possible. And so anything is possible. And if you can get it, it is recommended up to 26 without any questions whatsoever. So at 24, you're still eligible to get it and get it safely. It's just that it's now a 3-shot series at that moment, and then 1 month later, and then 6 months later, and then you're completely vaccinated. Beyond that, at 27, it's a discussion with your healthcare provider up until 45, whether or not you're considered to be at risk and whether it is a good idea to get it or not. So 24 is certainly a good age to start. I actually see young women up to 23, and I've vaccinated women who, for whatever reason, chose not to or did not get it earlier, and I will start vaccinating them in their early 20s.
Is there a test for men for the HPV virus? I haven't seen anything regarding that.
Great question.
We got the pap smear, right? Where for the women, we know the pap is, we can figure it out from there. For the men,
Right.
I was like, oh, you protect the girls, but you give the guys the vaccine, but you really don't have a test to see if they had it or they passed it to the girl. So it's just
Correct.
like, what do we do with that?
So for right now, there's no approved test for HPV detection in men. This also kind of piggybacks off the fact that you're correct. While we test for cervical cancer and HPV when we do a women's gynecological exam, we don't routinely test. It can also cause throat cancer. We don't test for your throat to see if you have HPV in your throat as well. So again, that's another reason all the more to get the vaccine, because we don't have approved tests to be able to tell you if you have HPV-related cancers, precancers in other parts of your body, or if you are a man, you have HPV-related predisposition to getting penile cancer or anal cancer.
Thank you.
And switch. Okay, so those are actually some really good questions, because Sophie actually asked some too, because I know we are centering around women because this is a very, very big issue within the community, but it is good to know about the men too, because I'm pretty sure there are some men watching this. So like, well, what about me? So it is good to know that they can also, that the vaccine obviously does something for them, and just to take like precautionary measures for that. So if someone has HPV, right, they've been diagnosed, they have HPV, is taking the vaccine going to do anything for them, or they have to take other things in place of as if they would have taken the vaccine?
No, so you still get the vaccine because, again, the vaccine protects against multiple forms of HPV. The most recent vaccine is actually Gardasil 9, so it protects against 9 different strains of HPV. This is actually even different because when I was growing up and when I turned 11 and got the vaccine for HPV, it didn't have 9 different strains, it had less. So the vaccine I got only protects me for certain limited strains. But what that means is if you have HPV, you should still get vaccinated for HPV, because if you only have 1 strain, it'll protect you from the other 8. And that can be helpful in protecting you down the line from other types of cancer that may come from the other strains of HPV. But again, if you know you have it, then definitely you have to keep up with your routine screening to make sure that you don't develop cancers, and hopefully you can be caught if you do end up going in that direction at a pre-cancer stage where they can be treated more easily.
Okay, we actually have another question that popped up. Someone asked, they said, what are the age ranges? I know we talked a little about it before, but I think they kind of just chimed in, so if you don't mind repeating that.
Sure. So for the 2-step series, ages 9 to 14, we most commonly give this at your 11-year-old well child visit if you go to the pediatrician every year. But from 15 to 45, it's a 3-step series, so you can still get it. From 15 to 26, we'll just start you on the series right away. From 27 onwards, we'll assess your risk and then decide as a conversation to see if you're at risk and then provide you the vaccine. Again, a 3-step series at that point.
Thank you. I'm going to see if we have any more questions from Facebook and our YouTube. Yeah. Oh, yeah, go ahead, Nia. Yeah.
Just wanted to add on to what Dr. Pawar was saying about the Gardasil 9. I just wanted to say that the strains that are covered are, like research has shown, that those are the most common strains. And it also not only covers cancerous or strains that cause cancer, but it also covers strains that don't, the non-cancerous ones, the ones that cause genital warts. That's also covered by the vaccine.
Thank you for. See, you guys are such like a fountain of. You're multiple fountains, actually, of knowledge. Because I feel like I'm learning so much. Because when I was younger and we were learning about some of these things, we only learned that there was like a couple of strains, and then now we know that there's like 9. And I feel like learning more and more is how we keep ourselves healthier. And education is power. So some people can say, or education is key to hopefully open the door to a better society, a healthier society, because it's all about being healthy and educated. So you have a question about talking about like the different strains. So if I were to have gotten at age 11, I'll give you a hint, I'm 25 now. If I got at age 11, the Gardasil 4, I'll call it, right? And it's 4 strains. Should I get the Gardasil 9 now? Or should I just leave it alone because I already had the one with 4?
At this time, they're not recommending that you get the HPV 9. The HPV 4 that originally came out that you received covered, believe it or not, 70% of the types that led to about 70% of cancer. So of the 4 strains, types that were covered by that vaccine, it covers 70% of the cancers. The ones that from the 9 actually cover 10 to 20% more. So it's close to 90% coverage against the what is considered the high risk types. There's actually over 100 HPV types, but the 9 that were chosen for the vaccine, the current vaccine, the only one that you can get right now in the United States, covers somewhere around 90% of the cancers, the ones that would lead to cancer.
Oh wow! See, I didn't even know that was 100. Wow! All right.
So 70% is good too.
Yeah. that is true. There's good and bad and everything, right? But yeah, thank you for explaining that though, because I was thinking about it. I was like, should I get like another one because this one covers more stuff, and shouldn't I want to cover more things? But you already explained it, Dr. Lee. So thank you so much for explaining that. And I'm going to check one more time to see if we have any comments. For those who are wondering why there's this random HTTP link at the bottom, it's for the post poll, just asking you some of the similar questions that we asked at the beginning. Even if you didn't come at the beginning, it's completely fine. You can still fill it out. So you can just have an idea of what the community got from the presentation or got from our Q&A just now involving HPV, because we want to know if we made an impact. We want to know if you guys learned anything, because if not, we got to do it again. I mean, we'll do it as many times that is necessary for the community to feel like they're well knowledged about this, and hopefully be able to talk about some more topics that do affect us as women, as a community, overall human beings that have health problems or trying not to get health problems. So I'm going to have the poll just kind of lingering there. It's also in the chat, both for YouTube and Facebook. Are there any helpful tips or words that you would give anybody who is kind of resistant maybe to taking the vaccine? Because there are people who are resistant to taking vaccines, period, or not too sure about how it's going to affect their bodies, because people think about allergic reactions. They think about how they might have other medications or different things that they take that they're like, well, what if this messes with the vaccine? Like, is there anything that you can say, or any one of you guys want to say, that like help encourage them or make them feel better when it comes down to the vaccine?
Yeah, definitely. Talk to your doctor. I think it's important to have like a good relationship with your primary caregiver. You should be able to talk to them about all your concerns, all your worries. And I think that's why it's important, especially for children, to have like a health home. A health home means there's someone that you're seeing. It's the same person every single time you go. So you have a relationship with them and they know you and they know what you have and what you do in life. And should be a conversation you absolutely should have with them. We have great research that, suggests that it's safe. So I absolutely myself would encourage it, but talk to your doctor.
Thank you so much for that, Anika. Bye-bye. And as a resident citizen of the non-medical type, yet I'm in the more of the mental health than the physical health area. It can be scary doing anything you're not sure about, anything that you don't have enough knowledge about. So I do agree, talk with your doctors, listen to these lovely people on the screen who know what they're talking about, have dealt with the vaccine before, have dealt with many people who probably have similar concerns as you do in regards to taking the vaccine. At the end of the day, it's about your health. It's about your well-being. It's about being safe, and it's about being protected. So that's what I guess I'll say. If that helps on the flip side, person coming to the doctor's office as opposed to being the doctor. And yeah, I think that's pretty much it. I don't see any other questions. I'm going to see if there's anything. I'm going to actually bring up Carolyn and Sophia just to see if there's any last remarks they want to say. So boop, and let me bring up Sophia as well. Boop. And do you lovely organizers of this event have anything you would like to say to the people on the screens?
I want to thank everybody for listening.
Well, I actually had one.
Oh, go ahead.
Sorry, technology. No one hears anyone.
Okay. I actually have one question regarding the vaccine, and this I have come up with before. Some of my patients have said, you know what, when I took the first set of vaccine before the new one, which was the Gardasil 9, I only had one vaccine, and now I missed the time that I was supposed to be vaccinated. Subsequent, I guess, vaccines, the second portion, right? So is it okay if I took the 9 then? Because you only had one series, so you actually didn't complete the series. So would it be safe for me to take the 9?
Yes. So after a certain amount of time, actually, you just restart the whole series. So they would restart you fresh. You would get the 3 doses. Well, depending on your age, I assume it's an older person. You would get the 3 doses of the Gardasil 9 now to complete the series.
Thank you. And I know someone had asked in the chat that what are the age ranges, but I think you guys could someone just reiterate that regarding the Gardasil? And
sure, absolutely. So between 9 years of age and 14 years of age, you would get a 2-shot series. Most commonly, if you go to your routine well child visit, we give it this at 11 years old. We'll just bring it up to you, but your pediatrician will talk to you about it and ask you then if you want it, if you haven't already gotten it. And then from 15 to 26, it's a 3-shot series. Again, we'll just start you on it and you'll complete the series. From 27 onwards, it's still a 3-shot series, but it also becomes a discussion then with your doctor about, are you at risk? Do you need it? That stems from just like the evidence right now of how well we know you form immunity and protect yourself. We know it's better when you're younger. So there's less data available for older individuals, but as we've gotten more and more information, we've learned that, the older you get and if you get vaccinated, you still get some form of protection.
Okay, thank you so much. Are we ready to do the poll, or are you gonna wait? Carolyn, go ahead, speak.
Naja, did you post the test already?
So I did the poll. I'm going to see if anyone did answer the post test, but I did put up the poll both in the banner, which I can pull up again. Boop. And it's also in the comments for the Facebook and YouTube, but I can check right now to see what the percentages are real quick. So I'm going to remove myself real quick. If you guys, do you want the percentages out in the live, or what would you like?
That's
Okay.
okay. Yes. Yes. So the post test is basically to see if, hopefully anybody learned anything, gained knowledge. I'm sure everybody did. I feel like the panelists were excellent. It was a wealth of information. And if I had to make a decision whether to vaccinate or not vaccinate, I would definitely vaccinate. I think you all did a great job in answering the questions, and I feel like we're leaving with more knowledge, more education than we had when we came on. So thank you for your expertise in this area. I want to thank the people that are listening. We love doing community presentations like this and educating the community. So let us know any future topics that you would like to learn about. And thank you, Sophia and Naja. You both were great. It was an honor to partner with you, and you're a great organization. Thank you for everything you do for the community. And also, I want to just thank the American Cancer Society. They were a great resource for us and so helpful. So have a good evening, everybody. Sophia, anything else that you want to say?
Awesome. Yes, actually, yes, very much so. Thank you so much. It's been very enjoyable conversation, and I hope that the information that we send out received well. I did want us to save the date because we do have a couple of conversations coming up. We're doing one on February 19th. I'm sorry, February 12th with ONA and ONA, which is Office of New Americans and American Asian, along with speakers from Masjid Tabor and, of course, SIUH, Northwell Health. And we're going to be talking about a topic, demystifying the COVID-19 vaccine, another vaccine topic, guys. So I hope that you guys can be able to watch and yes. And then we have another event coming up also. This is a Taboo Talk again, uh, February 19th, and we're going to talk about culture competence and health equity in communities of color. So this is going to be a nice, tie-in to all the conversations that we've been having. So I hope that we'll be able to have more conversations like this and be able to help our communities in the best way possible.
Yes.
And thank you again, wonderful ladies, for your time and your knowledge.
Yeah, one more thing. Did you ask me, Naja, if we wanted to go over the questions?
Yeah, just in case some people may not have seen the questions.
Yes, I misunderstood. I apologize.
Yeah, it's okay. Technology.
Yes, we absolutely want to go over.
No, it's okay. I can go over the questions that were on the poll. So the first question was the human papilloma virus, aka HPV, the star of today's conversation, causes cervical cancer, and we had true or false as the option. So the answer to that is true. It can cause cervical cancer, and if you guys want to, for those who haven't watched it, the video will be uploaded completely on our Facebook and YouTube, so you can always go back and listen again to our wonderful speakers today. The second question was cervical cancer can often be prevented. And it was also a true or false question. And the answer to that was true. So it can be prevented, as we talked about before. What can help prevent that? Having the vaccine. Having the vaccine helps you not get HPV. Not having HPV can help you not get cervical cancer. So the third question is cervical cancer usually doesn't cause symptoms right away. And the answer to that is true. So some of you have heard from the doctors as well as listening and watching the presentation that symptoms don't always come right away when you do have cervical cancer, but it is good for you guys to get tested relatively frequently so you can catch things as soon as possible. And the last question was, if you had any type of hysterectomy, you can't get cervical cancer and don't need to be tested for that. And that is a big, giant false. You still should get tested for it because you still have a chance to potentially get cervical cancer, even if you've had any type of hysterectomy. Almost couldn't pronounce the word. Any hysterectomy. So those were kind of just some questions that we had asked you guys both before and post. Hopefully you guys learned something. Hopefully you guys gained some insight. If you were kind of teeter-tottering on the idea of getting the vaccine, hopefully you tottered towards the direction of wanting to get it. And I want to say thank you again for all the amazing speakers. Thank you, doctors and doctors to be, for being here and explaining things to us, quote unquote, common folk, about the vaccine, about things that we need to know, and kind of overall helping us becoming more educated and more well-rounded about this. And I think even for myself, even though I've gotten the vaccine, I feel like I would be comfortable getting the vaccine again if I needed to get it again, through this conversation. So thank you guys so much. Thank you to our audience for listening and watching. Yes, Sophia, go ahead, chime in.
Oh, Carolyn, when you get a chance, send me that information for the resource. We'll post it on our page following this event.
Yes.
So for people who may want to have those resources for SIUH.
Absolutely.
Yeah, so we thank you. That was great, because I'm pretty sure some people are like, well, where are the resources? It flashed across the screen and I didn't get a chance to see it. So the resources will be posted up on our social media platforms for you guys to see. You can also find it on the American Cancer Society website. You can also find information on the Staten Island University Northwell Health website as well about anything that you need. And again, just thank you to everyone here on the screen, behind the screen, across the screen, anywhere you are on the screen. Thank you for your participation, and I hope you guys all have a good night. Thank you. Bye-bye.
Thank you.
Mhm.
Bye.